Hello, I'm Dr. Tanya Ghosh. I'm an ophthalmologist here in Sunnyvale who has specialized in treating diseases of the retina. I'm a retina specialist. Today I'd like to discuss a few conditions of the blood vessels of the retina that can lead to loss of vision, either partially or extensively. The main topic in today's discussion will be vein occlusions. This loss of vision happens suddenly and without pain. As we jump into this, let's start with some very basic anatomy. This is the front of the eye called the cornea. The area that gives us our eye color is called the iris. Now I'm pointing to the lens of the eye. This is the area that helps focus objects. This lens starts off clear when we are born, but gets cloudy with time. We call clouding of the lens a cataract. Cataract surgery is essentially a lens replacement where we remove the lens and insert an artificial lens in its place. Here in this space lives the gooey substance called vitreous humor. The inside back of the eye is coated by a tissue called the retina. The retina receives the light signals and sends it to the brain via the optic nerve. The retina has many blood vessels, as you can see here. The center of the retina has a name, and it's called the macula. The macula is very important to us humans. The macula is what gives us our ability to see fine details such as reading and seeing the fine distinguishing features of one's face. You must have fine vision to distinguish between letters such as P and B and also recognize each different number. Animals such as deer have excellent side or peripheral vision. We human beings, however, hold our central vision in high regard. The retina has blood vessels coursing through it. The artery brings blood into the eye, the vein removes the blood and takes it out of the retina. Between these two are capillaries where oxygen and nutrients are released to the retina. And then the byproducts, along with carbon dioxide, are picked up and sent back to the heart and lungs via the veins. We will start first by talking about vein occlusions. This is a blood clot in the vein. Essentially, the blood was supposed to leave the eye, but was unable to because of an obstruction, where then the blood backed up and caused an explosion in the retina. When this occurs, some of the retinal cells die. However, there are some cells that don't die, but are rather quite, stunned. Some of these cells become temporarily dysfunctional, and some also swell up. Kind of like when you punch your arm and the tissues swell up. We don't have a treatment for the dead cells. We can't bring those back to life. However, we do have treatments for the cells that are stunned and have swollen up. These swollen cells, when in the center of vision, which is the macular area, tend to blur or distort vision. Our treatments resolve the swelling to recover that vision. Why do blood clots happen, you may ask? We don't exactly know why these blood clots happen. The original thoughts were that the arteries and veins travel together in a sheath, and that the hardening of the artery presses down on the softer vein and causes it to clog and then have a backup. This description is not a bad picture to describe a vein occlusion, but there might be a bit more to it than that at the physiologic level. We won't get into the weeds with that discussion, but we will segue into the discussion that these occlusions are a sign of unhealthy or compromised blood vessels. The major culprits for unhealthy blood vessels are hypertension, high cholesterol, and diabetes. There are, of course, other causes such as stagnant blood flow from autoimmune or inflammatory diseases, other blood disorders, some cancers, but by far the most common causes are the three mentioned: hypertension, elevated cholesterol, and diabetes. Sometimes just aging can be a part of this equation also. Vein occlusions are categorized based on the location of the vein which is blocked. If it's the main vein from the retina, we call it a central retinal vein occlusion. We usually see lots of spots of blood throughout the retina when that occurs. That can mean a lot of tissue death and dysfunction. If, however, just one of the veins becomes occluded, we may see retinal changes in just 1/4 of the retina. This is called a branch retinal vein occlusion. We only treat if there's swelling in the macular area causing distortion in vision, or if there is an unusual growth of blood vessels. We don't have a way to undo the clots themselves. Sometimes the clot is small and resolves on its own, and sometimes the body makes a work around the area and bypasses it. In some cases, the swelling can go away on its own, but other times it's really dysfunctional to the person, and we do have a way to resolve that swelling. What are these treatments? There are 3 major treatments, and I'll list them from the most common to the least. The most common treatment is the injection of an anti-vascular endothelial growth factor, or biologic, or some steroids into the eye to decrease the macular swelling and to stabilize the retina in general. This can be used also to treat the growth of new blood vessels, which is a bit more rare. We first clean you meticulously and prevent any infections, and we numb the eye really well. Then the injection is given with a very fine needle into the white part of your eye. It takes about 2 seconds to give the injection. Are there any risks of injection? There is one major risk, which thankfully is very rare, and that is the risk of a permanently blinding infection. If a bacterium gets into the eye during the injection, it could potentially kill the eye. Thankfully, this is very rare, and we take lots of care in preparing the eye with the intention of avoiding this. After the eye injection, I ask that you not get into a hot tub or swimming pool for 24 hours. If an infection were to occur, it tends to happen about 3 or 4 days after the injection. You may feel new pain, new redness, new blurred vision, or even swelling of the eyelid. If that happens, call our office immediately. If your eye bothers you on the actual day of the injection, it may be due to the cleaning ingredients such as betadine. I recommend putting a cool compress on the eye, using lots of artificial tears, and taking a pain medicine, and the best is to take a nap. Hopefully that feeling will pass quickly. These written instructions will be handed to you later. These treatments are usually given via quick injections, but there are some other alternatives where we can surgically insert devices that will give continuous release of drugs, but we don't use these as frequently. We also can apply some baby laser either to the macular area or to the area affected in the retina to tame the macular swelling. Sometimes we use laser in cases that are more advanced and more vision threatening, such as when the new blood vessels appear. The third way of treating it is a surgical procedure, which is a pretty rare occurrence. Outside of macular swelling, the retina that suffered a lot of death of retinal tissue can infrequently start to develop brand new blood vessels called neovascularization. These develop because the body still has some retinal tissue, which is yelling out to make new blood vessels in hopes of getting blood again. But these new vessels are not as strong as the ones you were born with. They can rip and bleed, and they cause scar tissue, which causes the retina to be pulled up, detached, leading to blindness. In rare cases, in a central retinal vein occlusion, where a lot of death of tissue has occurred, the eye can create new blood vessels called rubeosis in the front of the eye. If left untreated, this can clog the drainage system of the eye and then cause the eye pressure to rise such that the eye is in tremendous pain and eventually leads to a painful death of the eye. Not to worry, we have treatments for all of the above as mentioned before. How do we make the diagnosis of a vein occlusion? We start by doing a comprehensive exam of the eye. We take photos of the retina and get an OCT, which is an optical coherence tomography. This test gives us a cross-section of the macular area, which shows us the amount of macular swelling. Usually, the look of a retinal vein occlusion is not subtle. It's not hard to miss. Sometimes we will do a fluorescein angiogram if we need a more detailed look at the retina. If we need to do that test, we'll certainly have a discussion with you about that test, where we inject the dye fluorescein into your arm and take pictures of the back of the eye. Back to treatments. I usually start by injecting the biologic Avastin into the eye. This is a biologic which was originally developed by Genentech and FDA approved in 2004 for colon cancer, but pretty much all retina doctors throughout the world have either used it or know about it. The government knows that we use this medication frequently. Once I inject the medication, we have you return to the clinic to check this optical coherence tomography, or OCT for short, in about 5 weeks to see if the injection was successful in reducing the central fluid. You, the patient, may notice an improvement in vision over this month when the injection is working well. At times, it may take a few injections before we see significant results. If I don't see adequate improvement, I usually suggest changing the medication in hopes of improvement. We are so fortunate to now have many options for improvement. Sometimes we resort to steroids. If there is resolution of the fluid without marked improvement in visual acuity, that can mean that the cells in the macular area were compromised by the vein occlusion itself. And we, unfortunately, don't have a treatment to bring back the dead cells. Also, when there's a macular swelling, or as we call it, macular edema, we must continue to give injections to keep the swelling at bay until it eventually fully resolves. The average person can take 3 to 4 years before this truly happens, but it varies. I know this can sound onerous. However, in the not distant past, there really was no good treatment at all, and a patient was burdened with a lifetime of blurred vision. The goal is to give the injection as infrequently as possible, yet keep the fluid away. In the beginning, we start by giving the first 3 injections about a month apart. If successful, we start elongating the interval. This is not expected to be a lifelong treatment. Eventually, we hope that the fluid stops and we can stop the injections. Now let's talk about laser, which we did much more frequently in the past before the development of the injectables, because in today's world, the injectables tend to work very well. This was the original treatment of choice before the advent of these drugs, and today we still have this tool in our kit, but we tend to use this much less frequently. If there is some residual macular edema, we can do fine laser in the hopes of resolving the fluid. This laser procedure is less than 10 minutes long. It's truly painless, but it does take time to work. It can be upwards of 9 months before we see the full effect of the laser. In today's world, we tend not to like laser as much because each laser scar is killing just a wee bit of retinal tissue, and we want to preserve as much tissue as possible. There is a risk of hitting the central macular tissue with the laser, which can lead to permanent decreased central vision. But this mishap is really rare, as retinal specialists are very well trained and very well rehearsed in all laser procedures. The second laser treatment is a larger, more extensive laser called pan-retinal photocoagulation. We tend to use this when there is rubeosis. Rubeosis are these bad blood vessels in the front of the eye that can clog the drainage system. We continue to give you the injectables, but then we do a large, more extensive laser to essentially kill all the defective retinal tissue, which is calling out for the formation of neovascularization. This laser takes about 3 sessions, around 20 minutes, each separated by a few weeks. This laser, however, can be a little bit more painful, and I thus recommend that you take a pain pill of your choice, and we give you an ice pack to put on your eye to mitigate the discomfort. That being said, there are many who don't really feel any bad discomfort at all. I choose to do my laser treatments sitting down at the slit lamp, but there are some doctors who do this standing up. I start by numbing the eye, then actually putting a lens on the eye to stabilize the eye and prevent it from blinking and to magnify the area for me. Immediately after the laser, you're going to be blind for about 3 minutes because the lights have been so bright. Your vision will quickly return. The side effect of the large laser is some decrease in peripheral vision, some loss of night vision, some loss of color vision, some generalized loss of vision. We do this to prevent the complete loss of the eye due to extreme pain from elevated eye pressure. This laser usually puts the issue to rest, although in some cases we may continue to do injections. We just had a long discussion on laser, but in truth, in today's world, most of our cases are handled by injections. What can you do for yourself should this happen to you? What can I do to help my blood vessels? Number 1, consider improving your diet to make it mostly, if not fully, plant-based and avoiding fast food and processed food. We do this because they are the major culprits of diabetes, hypertension, and high cholesterol. Number 2, be sure to move the body through meaningful exercise on a routine basis. Number 3, prioritize restful sleep. And number 4, consider incorporating a meditative practice to mitigate the stress and tension that the world throws at us on a daily basis. Before I conclude, I want to address and differentiate a vein occlusion from an artery occlusion. I called a vein occlusion a blood clot. An artery occlusion is essentially a stroke because the clot is in the artery and it causes immediate death of tissue downstream where the blood was supposed to go. These are treated like a stroke. We usually will send you to the hospital or emergency room to make sure that there are no other strokes waiting to happen. There are some treatments that might be available if this stroke is found within 2 hours, but usually there isn't much treatment once that has passed. We just want to prevent future strokes. In all cases of vascular issues in the retina, we partner with your primary care physician to optimize your health to prevent further incidences of vascular issues. This was a long, comprehensive discussion on vascular issues of the retina. It was comprehensive and complex, but don't worry, we'll have many more discussions as needed. Your doctor will be in with you shortly.